oftentimes then we have middle-aged men come in, late 30s, early 40s. It sounds like that's kind of where things kind of start to fall apart for most men. Your most common issues are fatigue, a loss of motivation, just not able to sleep well, no, sex life, things of that nature, right? So just getting older.
Hi, and welcome to The Holistic Entrepreneur, where we explore innovative approaches to healthcare through conversations with pioneering practitioners. I'm your host, Zane Myers. Let's dive into today's episode.
Welcome to another edition of The Holistic Entrepreneur, and I have special guest, Rafael Akobundu, and I had to ask him how to pronounce it before we started because I was going to screw that up, but
okay,
we're all right.
You get screwed up all the time. It's all good.
Yeah, I bet it does. So, Rafael, you started out as a registered nurse. I kind of like to get a little bit of background before I just launch right into somebody, because I think it's interesting, somebody's history as they, got to where they are. And you're actually from another country originally. When did you immigrate to the United States?
Yeah, no, good questions. Then I moved to the United States when I was 12. So this is 2001, February. So I came over with my parents and my three sisters at the time. I have four sisters now, but one was born in the States. But yeah, I moved in 2001.
Yeah, so I can tell you talk like a native because I don't notice an accent.
I know most of it is gone.
Yeah, probably when you're hanging around your family and everything, probably can slip back into the accent pretty easy.
Yeah, a little bit of. We're a British colony, so I always spoke English, but most of the accent is gone for sure.
Yeah. So you immigrated it when you were 12, and then you professionally you started out as a nurse.
Yes.
And were you there in San Diego when you?
No, I was in the East Coast, so I graduated college in New York, and then I went to nursing school in Cleveland, Ohio, and then I moved out west to Arizona. So my first nursing job ever was in Phoenix, Arizona.
And then how'd you end up in San Diego?
I would just visit San Diego while I was in Phoenix, and I fell in love with it. So I ended up moving to San Diego in 2015 and met my wife at work, who's also a nurse. So it's kind of home for now, home base for good, just because she's there, and it's a nice place. Yeah,
it's a great town, especially you don't miss Phoenix come July.
Yeah, that heat can get to you. It's dry heat, so it's not like unbearable, but it can get pretty toasty there.
Yeah, it can get pretty toasty. You were a nurse for quite a while, and then how long were you a nurse? So you started this hospice,
yes.
And that was your first business, and we're going to get into your second business too, because I think that's interesting. So you started that business with your wife. How did that all start?
Yeah, so this was back in 2022. I have a good friend of mine who owns a hospice company as well. And he thought it would be something that would be a good fit for me in terms of owning one, just because of my background being in clinical and being personal and things of that nature. So yeah, in 2022, we decided to take a leap of faith and decided to start one. So it's been a fun ride so far.
And so, but then you've more recently started this other venture, and you've got your T-shirt. I really appreciate you promoting your business. That's fantastic.
Yes, of course, no problem.
Huddle Men's Health. So when did that start? You actually have two locations now. When did that start? When do you?
Yeah, we have two locations, one in Seattle and one here in Temecula, California. This started in 2023. However, prior to starting the hospice, I was already in the testosterone space prior to that. So when I left my previous company, I started my own in October of 2023. So it's been less than 2 years of that.
So you had experience with men's health previous to, so it wasn't completely, you didn't go into it, let me go start some men's health. You were already working in that area.
Yeah, I've been treating guys for low testosterone since 2017. So it's been quite some time now.
Okay.
Yeah.
And then, but when you start an office and you've got the rent and you've got employees and you've got all these other things going on, that can be pretty stressful. How did you get your first customers?
Yeah, it's a great question. So a lot of it is usually just kind of in the beginning, it's just like a lot of hustling, right? So you have
Mm-hmm.
those early adopters who are usually like friends and family.
Yeah.
Those people usually get through the door first, and then you always encourage them to tell their friends and tell their friends. So usually our first few clients are usually friends and family, and then we get patients through them, and then we also do some just digital marketing that helps as well. But initial patients are usually friends and families.
So I I looked at both of your sites, Blue Monarch, the Hospice, and then I went and looked at Huddle, and I thought they're both really well put together. I don't know who does your marketing, but they do. Seems like, or your webmaster, whatever, they do a good job. And I noticed that they kind of localized on Blue Monarch. According to areas of town, probably people who aren't SEO geeks don't know what I'm talking about. But,
Yeah.
so you have probably become a little bit of an SEO person by having these two
Yeah,
companies.
yeah. I mean, that's a little like far fetched. I know the basics, right? I just, we just obviously pay an agency to do that for us. So I don't know like the ins and out about it, but obviously having a digital presence is very important. When you run a service business like we do. So we do have yes, SEO team that kind of helps us with.
So tell me about you're getting going. You get your friends and family to start coming in. And how long did it take you to? I'm going to ask business questions too, because I think I think that when you're doing a healthcare kind of thing, some people forget that when you're running a business, you're delivering healthcare, but you're also running a business, and
Yes,
so you have to wear these two different hats.
yes.
One is to take care of your patients, and then the other is take care of your pocketbook, make sure that you're profitable and things are working. So when you were in San Diego, how long did it take you guys to get to a place where you were in the black? Or
It's about my hospice company. Is that right, Zane?
well, either one.
Oh,
I guess
yes.
from the,
We'll start with the hospice. Yeah, I mean, I think the biggest thing about hospice is a very like operationally is very intense because it's 24/7. So we're providing
right.
services to terminally ill patients. So it's a very delicate situation. So customer service has to be absolutely amazing, right? From our perspective. But initially, I would say we opened up in March 2022. I would say the first 8 months, I essentially did everything, as much stuff I can do. I was the nurse, I was the marketer. I was the nurse's aide. I was the administrator. So everything, just like your typical founder story, right? So every hat you could possibly think of, I wore in the beginning, just to be as lean as possible in terms of expenses. So once you get to the company and it was fun, but at the same time, it was hard, but it's fun because it's your own stuff, right? So it never felt like it was this thing that was like overbearing or anything like that. But anyways, got it to the point where I could hire someone. So the point when I got to a point where I could afford to hire someone, I did that. Even though it was a little bit of a struggle, just because I'm a fairly like new entrepreneur,
Mm-hmm.
giving away that trust is very hard in the beginning, right? Like giving someone like a job title and say, I trust you to do this and this and that. So eventually that's the only way I learned. That's how you grow. You just have to delegate things. So I got to the point where I was able to luckily afford to hire these people. And that's kind of how I got there. But the first 8 months, I did a lot of the stuff myself.
So where are you now with that business versus where you started?
Well, I'll just give you like in terms of number of employees. So when I first started, I had,
Yeah.
maybe a handful of employees, 4 or 5, maybe. Now I have 31.
Wow,
So,
that's great.
oh yeah, it's kind of how we've grown. So it's good. Yeah. And it allows me to work on the business, not in the business, right? So that's, usually what every founder would like to do. But I was in the business for a long time. I'm still kind of in the business, but not as much as it was in the beginning.
So do you have some key people that are running that for you? I mean, because 31 employees, they can't all report to you. You'd
Yeah, yeah,
be
I'm lucky
pulling it.
some key staff members that do like essentially run the show. For me, it's kind of like I just get out the way. Like I mean, I oversee things, but I kind of get out the way because most of them have been in the industry a lot longer than I have. I lived in the
Hmm.
industry 3 years, so they know a lot more what they're doing than I do in terms of operational standpoint. But there's other things that I have to kind of oversee. But I'm lucky enough to have awesome staff members that kind of run the show, without me having to physically be there.
So in your spare time, which I imagine that wasn't, so how in the HE double hockey sticks did you think, okay, well, I got this thing going now pretty good. I'm down to working like 60 hours a week. I think I start another business.
Yeah.
Is that accurate?
Yeah, no, that's a good question. I mean, the thing is, I think a little bit of background is I was already in that business before I started the hospice, but I left that company and then started my own. So this was actually a lot easier than the hospice, because the hospice I had no clue how to run one, like absolutely zero clue. Kind of just like went in head first and just figured out as I went. The testosterone clinics, I already been part of a clinic before for a couple of years, so that was a little bit easier, and it's not as intense in terms of operation as hospice.
Mm-hmm.
It's a cash pay business, so it's a lot. You can kind of like navigate things and structure things how you want it. So that was a lot more easier than a hospice to set it up, because I've already done it before in the past.
So as far as getting staff for the hospital, you have to have, medical doctors on board. You have to have all these people, and those are, did you bring them in as partners, or did you bring them in as employees, or how did you structure that?
Yeah, that's a good question. It's very hard to like hire really good staff, especially in the hospital space. So in the beginning, it was a lot of no's. A lot of people told me no, just because it was brand new. No one knew who I was. So just a lot of networking, and eventually, like I said, I did a lot of the stuff myself. So I wouldn't say I had a reputation, but people started hearing about me and kind of like good work we were doing out there in the industry. So they were more open to coming on board. So they just came on as employees, and most of them have been great ever since. Kind of that's been the case.
No, I mean when you set up your Men's Health,
okay.
you have to have. Did you bring on the physicians there as partners, or are they part of the business, or are they separate from?
Oh, I see. In terms of, are they part of my hospice? Is that your question?
No, part of your Men's Health. So you have the Men's Health business, which is separate, which you're the CEO of that business, right?
Correct.
And so you had to hire some pretty expensive people to, physicians. And so I'm just curious, and you can tell me, no, Zane, I don't want to talk about that
Sure.
if you feel like it. So, but did you bring on those people as partners, or did you just buck up and say, I got to pay this, and this is the way it is?
Oh, no, I just paid them and just brought them as employees. Yeah. So I just kind of just hired them, and they've been wonderful. Our medical director, he's a spine surgeon. So he's really cool. He's in Seattle area, still our medical director in Washington. But yeah, I just hired him. I found him through a friend. And then my other staff members just from posting on your typical job sites, Indeed and ZipRecruiter and things of that nature.
Okay.
Yeah.
Fantastic.
Yeah.
So how do you, from a regulatory standpoint, I'm asking you all kinds of technical questions. So right. I ask things that I'm curious about. Sure. So, and hopefully then the audience will also be curious about these things. Sure. From a regulatory standpoint, is there any sorts of challenges with that?
In terms of, it's a regulatory in terms of the testosterone clinic?
Yeah.
Yeah, I mean, it's a controlled substance. Testosterone is a controlled substance. So whenever you have a controlled substance involved in anything, you have to make sure everything is in place. So we do have to have a medical director on staff per Washington law, state of Washington. If you have a nurse practitioner, I'm a nurse practitioner, but if you have physician assistants working for you, you have to have a medical director. So we have a medical director. And then we also have, obviously, people like in the office, a medical assistant and an admin staff in the office. We have a lab in house, people say, so that goes through state testing. So we get surveyed. So our surveyor comes out from the state, and then they're pretty much all day. It could be a few hours, it could be all day. And they go through all our files just to make sure we've done competency tests and all the staff, and all our books are up to date. So there is a lot of, things that go into place there. And then we also have a software where we have to log testosterone that's dispensed in the clinic, because at our clinic, we have the options of patients coming into the clinic for their administration of injections. So you have to keep a log of that, because the DEA wants to see every single ounce of testosterone dispensed in that clinic is associated with a patient. Because if you if you don't have that, you can be heavily fined, and no one wants the DEA show up at the door. So it's highly regulated in that regard because it's a controlled substance.
So what made you decide on Seattle? Other than I do know that there's some big players in men's health and that that are in Seattle already.
Yeah.
Was it just because that was a well developed, or the population was really aware of that? Is that what attracted you to Seattle?
That's a good question, Zane. My one of my partners lives in Seattle, so that's kind of what attracted me. So I would visit him, and he always talked about Bellevue. I had never been to Bellevue. Obviously, you probably been to Bellevue, being up in this.
I'm in Bellevue right now.
Bellevue right now. Oh yeah, exactly. So there you go. So the demographics plays a huge role, right? So we're a cash pay clinic, so you want to be somewhere where people can afford your services,
right?
So we thought about, hey, but in terms of the big players, there's competition and everything. If there's not competition, that means there's not a market for it per se, right? So we felt comfortable putting it there just because they thought it would be a great area, and it's been really good to us. So yeah, that's kind of why we did.
So how does how long before you started this thing? You started the men's health in San Diego, and then you opened the second office in Seattle. How long between those two?
No, so my other office is not in San Diego; it's in Temecula, California. Which
Temecula? Okay, I know exactly where Temecula is.
So it's like northeast of San Diego.
It's like Phoenix, only in California.
Yeah, it's actually, Bellevue opened up in October 2023, and then we opened up Temecula in June of 2024.
Oh, okay.
That is
so the other way around.
Yeah, it was second. So about 8 months. Yeah, so it wasn't too long.
So you had an opportunity because you had this relationship with somebody there. You knew about the business, and then you had somebody that you could trust, that you could work with, and that allows you to open at a distance away from where you are.
I live in San Diego, so it's awesome to have them kind of oversee things there while I'm not there. So it's been good. It's been good.
So if you do this over again, what was the biggest mistake you made? I mean, I'm sure there's a list, but
business in general, or just
the whole thing. What would you do differently?
Oh, that's a good question. I think what I would do differently. I mean, I'm getting better at it. It's just not to trust people so easily, because in business you get burned a lot. Whether it's through vendors or partners or whatever the case might be. So you have to have a good way of vetting people out, whether if it's a vendor or whether if it's like an SEO. I know you talked about that, or if it's someone that's just going to do something that's significant for your business. So you have to make calls. Okay, who have you worked with in the past? Call those people, see how that experience was, because it's been numerous vendors where you just lost money because you didn't get the value they thought you would get out of it. So I would say my biggest thing would be, because in the beginning every cent matters, and
yes,
it not giving you any value back really sucks. So the biggest thing is just vetting people out and just making sure that you've done everything possible that you can to make sure that's a good arrangement for you. Because if it doesn't work out, then at least you tried. My issue was I was not doing that vetting as good as I should have been doing it.
Mm-hmm.
Yeah.
So now you feel like you're older and wiser on those things.
And I'm older and wiser, and I always give people the benefit of the doubt. But now when it comes to business, I'm always skeptical at first, and then turn into a believer eventually. So yeah.
So you get the pitch, and you say, "Gosh, that sounds so fantastic."
Yes.
But then you get the deal comes down, it just doesn't work out the way that you were thinking.
No, and another thing is I always said yes to so many things. So now I say no to most things, which you have to, because if you say yes to everything, you're just wasting your time, really. So you have to know what you want to put your time to it. So saying no actually is a very, very good skill to have when it's in business. It's so many things come in all different angles, and if you start saying yes to everything, you're just gonna drive yourself nuts. I say no a lot now, in a nice way, obviously, not in a mean way or anything like that. But it's important to have a boundary of things like that.
Yep, that is really one of, in my opinion, a skill that needs to be developed. Saying no, I think, and that's something you need for their whole life, because I can also get sucked into.
It's very hard, very difficult, because I'm a very easygoing at just myself. So when people pitch me something, I understand how it is to be on the other side because I've done the pitching and some of my other business beginnings, and people give me. I always loved it when people give me an opportunity. So then I feel like for all these people, and I want to say yes to everything, but then a lot of times it ends up burning me. So now I have to like figure out how to say no, which I have been doing a lot more, and it's worked out.
What's the best thing that you're doing now that's helping you grow the most?
Delegation. Delegation is the best thing you ever do. In the beginning, I always wanted to do everything myself. I've only been in business, solo entrepreneur for 3 years. So it's a lot of stuff that I'm learning. In the beginning, Zane, I always wanted to do everything myself. I didn't want to delegate anything because I knew if I did it myself, I know what kind of work I put into it. I know if it was right or wrong, right? So then when I didn't want to delegate, I was kind of not burning out, but I was just creating all these stresses on myself. So once I started delegating, I just started growing, and it was just, things still happen, right? Something still doesn't get done right, but at the end of the day, it's still much better than you trying to do everything yourself.
So when you delegate, you kind of almost have to accept that things are going to get screwed up. So it's like, I can do it all myself and I know it'll get done right, but you can't do it all yourself.
You can't. I mean, you're always gonna have problems. So you just gotta like trust people to do what they say they're gonna do. And if they don't do it, then you just gotta deal with the consequences. That's all.
So what's your plans? So now you have, so Monarch, your wife is involved in that. Is that right too?
She's currently not. I mean, the whole idea
Okay.
is for her to be involved, but right when I started that business, we had our first kid, like literally
Okay.
like the month prior. And then we just had our second kid recently. So my wife is just mostly just with the kids. So it's really hard for her to be involved. And it's probably easier for her too not to be involved because, she probably stress her out and stress me out. So yeah, it's a
Yeah.
good arrangement we have right now.
Okay. So, so you kind of split your time between those two things, Monarch and the men's health.
Yeah, I do. I spend my time between the two, but a lot of my time I focus now is just like being home with the wife and kids and just taking it that family time is super important to me. But yeah, when I do work, I split my time between both.
So, well, how much do you work? You sound like you spend a lot of time at home. So,
Yeah, I mean, when I'm home, I'm working. I'm just around them, right? So it's like,
okay,
yeah.
yeah,
So I mean, I work every day. I can't quantify in terms of hours. It varies,
yeah.
but it's not like like a 80-hour work week or a 60-hour work week or anything like that. It's not anything like that. I have a lot of flexibility, but I try to go to the offices a couple of times a week. We have our meetings with the hospitals. I have meetings once a week at least with the staff. I try to make it in there at least twice a week. So and I work better when I'm not at home. So, when I'm home trying to work, it's just a lot of, just distractions. I try to be at home as much as I can just because, I don't know if you have kids. I have two young daughters. One is 3 and one is 2 months old. Uh, Time flies from what I've seen and heard, obviously. So it's just trying to, spend as much time as I can with them, when they're little. But that's not always the case. But most days I'm able to do that.
That's good for you. I mean, yeah, I do have kids. I have 4 kids and I have
Right.
7 grandchildren too.
Oh, wow. Congratulations. You look great. Great.
I wish they were all around. I mean, but yeah, because they say that like the first 18 years, you're with your kids all the time, and after 18, you're going to spend 90% of the time you spend with your children by the time they're 18, and then 10% for the rest of their life.
I saw that. I saw that quote, and that's very true. That is absolutely true because I'm 36 years old, and my parents live on the East Coast. I probably see them once a year. Ever since
Mm-hmm.
18, I probably saw them once a year because I was I played college sports, so I was always gone for that. Yeah, that resonated with me, and it's just that's very true. It's very true.
Yeah, it resonated with me too, and I can't do anything about it. I don't like it.
Yeah, no, you can't. They got to live their own life, but like those
Yeah,
first 18 years, you just got to make the most out of it.
yeah, and they're precious. So, if you were to go back and do the whole thing over again, what would you do differently?
In terms of business, starting a business, or
Yeah,
just
starting the business.
do differently. You know, I think I don't want this to sound cliche. I don't think I would do anything differently because what I like for me is I'm not risk averse, so I like to like take action when I see an opportunity. So
Hmm.
if I were to do something different, I think it would make me pause and not want to take action, if that makes sense.
Okay.
Yeah.
Sure.
So for me, yeah, I mean, there's things you can say. I can save money here, save money there, but it would just lead to me overthinking. And then when I overthink things, and then I'll have doubts, and I wouldn't do it. Right. So if I was to do anything different, the only thing I think about is just vetting people out, just to make sure people are who they say they are. They can kind of provide the service they say they could provide. But in terms of like starting a business, I don't think I would do anything different because every opportunity I've had, I've always just kind of just say, oh, this is great. I'm just going to do it. And once I say I'm going to do it, I just do it. So yeah.
So is your wife also a risk-taking personality, or is she a safe person?
Uh, that's a great question. I would say I'm more I'm more riskier now, but she was riskier in the beginning because for me, I grew up in Nigeria. I was never exposed to business. We lived literally like day to day kind of thing. She grew up here in San Diego. Uh, Family was kind of in business, kind of, so she was more exposed to it. So she kind of like understood a little bit better than I did. But now I take more risk than she does, just because I guess I'm an operator per se. So I've had a little bit more experience. But at first, when we first met, she was more of a risk taker than I was.
So does Blue Monarch? Do you actually have physical locations, or do you go out to people's homes to?
Yeah, it's so most hospices are community based. So community based,
Hmm.
and you go out to where patients live. So that's what we are. We have an admin office in San Diego where we
Hmm.
have meetings and staff. We have staff there, usually throughout the day. But we usually go to wherever the patient.
And so does it? I'd like to say I'm just satisfying my own curiosity.
Yeah,
So when you do hospice, I mean, if I'm in hospice, I'd rather be in my home than in uh, some building. But when you do hospice, how often do you have to have somebody there 24/7 versus somebody who is just comes and goes and comes and goes?
yeah, that's a great question, and it varies. It varies on it depends on the condition of the patient. So if you're people that are in hospice, they're deemed terminally ill. So if you're stable, you're comfortable. A lot of people think once you're in hospice, you're going to die the next day. That's not usually the case. So we have patients in hospital for a year, 2 days, 2 months. So if you're comfortable, it's based on kind of like what your needs are, right? So if someone who's a transition, meaning they're going to pass away soon, usually we see them typically every day, and sometimes we're there all day. But if it's someone who's pretty stable, they're slowly declining, then that varies, right? So it could be 4 visits a week, 3 visits a week. So it all depends. But usually when we're there all day, it's just usually mean they're going to pass away soon. So the patient needs that comfort, and also so does the family.
So it's got to be difficult to make that profitable because you're controlled somewhat by Medicaid, right? So you can only you get a certain amount of reimbursement per day, and then you have to deliver a certain standard of care, within that, and so there's it's just imagine there's a certain challenge with getting the employees, keeping the employees, getting them logistically all where they need to go, and paying the employees the right amount so that you can keep them and keep them happy, and deliver within here's your budget. Is that challenging?
That's always challenging, especially we're getting paid by the government. So we're mostly reimbursed by Medicare. Medicare does increase our
Medicare, yeah.
yeah, they do increase our reimbursement rates slightly every year. So as an operator, it's always a constant challenge. Cash flow is king, right, for every business. So you have to make sure that things are looking good. So yeah, people are more expensive, equipment is more expensive, supplies are more expensive. So that's kind of like where the entrepreneurial spirit comes into place, just navigating those issues. I think a lot of people deal with that. So for us, the only thing that makes us different is we're paid by the government. So we can't say, oh, we're going to raise our prices. We can't do it,
Mm-hmm.
right?
Yeah.
It's always it's always tough to navigate those, but we've been good at it so far. And like I said, Medicare does give us an increase every year, even though it's just a little bit. It still kind of helps. It's a really great service for the patient and families. It's never just going to go away. So they do try their best to make sure they're keeping up with inflation and things of that nature.
So so that that kind of business is much more intensive than the men's health. So are you planning on growing either one of those businesses from where they are right now?
Yeah, I would. I think so. My biggest thing is always something that I grapple with, and I think most entrepreneurs grapple with that is like when is enough, right? So it's like, do you want to have more location, make more money, and things of that nature? So there are certain things that I absolutely love, and that's free time. So I always tell people, it's like I started a business so I could have free time, right? Um, so now that I have a wife and kids, scaling is a very tricky thing. I think the hospice, it's only going to be in San Diego, won't be anywhere else. The testosterone clinic will open up one in San Diego or Seattle, one more, and then figure how things go from there. Because if, that's enough on my plate, three locations of that, and then the hospice, and kind of see how things go. Things are going well right now, so it's no need for me to kind of expedite anything. But I'm just trying to just take my time and not rush anything. But the testosterone clinic will probably expand that at some point.
So if you did that, then you'd want to plan that out. So make sure everything is copacetic and just exactly so at the one place, and then then pull your hair out and start something, another office somewhere else. But so you're talking about maybe expanding to a different place within Seattle because it's a pretty big town.
Well, Seattle or San Diego. So the one we have now is in Temecula. So it all depends. I'm not quite sure. We're in Bellevue right now. We thought about Kirkland, but Kirkland is just down the street from Bellevue.
Yeah, it is.
That makes any sense. So we're just, weighing options, but at the same, like I said, I have a 2-month-old at home. So, we're just taking a day at a time just to kind of see how things go. But yeah, we'd like to open up another men's health location.
So how often do you get up there to Bellevue to?
I was just there maybe I want to say 3 weeks ago. I'll probably be there. I try to get up there at least once a quarter. Sometimes it's hard to do that. I would like to go up there more often, but at least once a quarter I get up there.
So how do you run your Temecula? So you have some really trusted partner there in Bellevue. How do you have somebody similar in Temecula, or is that you?
It's mostly me because it's about a 45-minute drive, but the staff there, lucky we have great staff there. So they essentially just run things. If they have any questions, they usually just call, text me or something like that. But it's me, it's the main operator there. Yeah.
Yep. That's great. I think we're only 30 minutes in. Usually these goes for an hour.
It's all good. It's all good.
But I don't know whether actually tell me a little bit about maybe some patient success stories. Those are always kind of interesting to hear. Somebody came in and they're in a certain situation, and then they ended up going. Something else happened in the end and really changed their life.
Yeah, I mean, with testosterone, there's so many success stories with that. So I've been treating men since 2017 for low testosterone. Oftentimes, then we have middle-aged men come in, late 30s, early 40s. It sounds like that's kind of where things kind of start to fall apart for most men. Your most common issues are fatigue, a loss of motivation, just not able to sleep well, no, sex life, things of that nature, right? So just getting older. So oftentimes they come in and if everything checks out, medical wise, and they do have low testosterone diagnosed with that, then we do prescribe them testosterone. My biggest thing, however, that I feel like we do differently is I really hone in on lifestyle habits. That's super, super important to me. I don't know if I told you, I played college football upstate New York. So fitness and exercise and eating well, all those things are a huge part of my life. So I always try to tell patients that, and that's how I train my staff to treat the patients is if, we can treat you with testosterone. However, if you don't have all these other things in place, you're not going to feel that much better. So oftentimes, this is their first time hearing that or maybe really listening to that. So when these patients make these changes, it's literally a game changer. Like I've treated thousands of men that they've gone from like one kind of person to a completely different person for the better, just from doing the things we told them, and obviously prescribing them testosterone. So that's been a massive success. And then and another part of that is men are very terrible with going to the doctor, right? So if you actually average men, last time I went to the doctor, they can say, oh, like 10 years ago, right? So we do PSA screening. Prostate cancer is the most prevalent cancer in men. So we do PSA screening with all of our patients. We've had probably 5 to 7 patients where we've detected they've had an elevated PSA, which unfortunately turned out to be cancer, but good it was caught early. So if they didn't come to us to find out they had this, they would never caught it early enough. But those always a good feel story. I've actually had a patient text me last week. Just he came in for testosterone, but we couldn't prescribe it to him because his PSA was elevated, and he did a workup, and he ended up having cancer. But it was so early, but he still did his own thing, and they treated him, and now he's fine. So it's always awesome to hear those kind of stories.
So if you have somebody with an elevated PSA, they obviously can't take testosterone because testosterone. I mean, if they have cancer, then testosterone will help the cancer more than the patient.
Exactly.
So once they are treated for that, they can't really go back on testosterone, can they?
It depends. So usually we need just a write-off from their doctor, if it's the oncologist or the urologist. So we just need a sign-off from them that says it's okay for them to be on testosterone. Because if we don't get that sign-off, then we don't put them on testosterone. Just like a patient had, like let's say a patient had a stroke or a heart attack recently, we usually have their cardiologist and urologist give us a sign-off saying, hey, it's okay for this patient to be on testosterone replacement therapy. So oftentimes, if they've had prostate cancer in the past and they're like 10 years in remission, then that's usually okay. But if it's like a recent thing, then usually we have their doctors send us a letter to say it's okay for them to be on testosterone. Because we're not, we're just, we're not cancer doctors. So
right.
We have every party involved with that decision.
So when typically when the patients that you're seeing are men who are in their 30s, 40s, 50s, that are overweight or just lethargic, and then they come in and get on. How do you decide what dose to put somebody on in?
Yeah, we have a protocol that we follow. We usually put people on a very modest dose, the same dose, and we kind of work our way up from there. So we see how you do on that dose, and if you need increase in dosage, we usually do that. If you need a decrease, we do that. But oftentimes patients need an increase. We such a modest dose. However, more and more younger guys are suffering from low testosterone. So you see patients in their 20s even. So those patients, they can usually tolerate a higher dose just because they're usually more active, or they're just so low based on their age, they could use a higher dose. So it varies per patient, but we typically start most of our patients on the same dose, and then we work our way.
What do you do when, I had a fleeting thought and it escaped from me. I had a Joe Biden here for a minute.
Okay.
I forgot where I was going with that.
All right.
So, I've exhausted most of my questions. I really appreciate you coming on the podcast.
Of course.
And I think you'd be a great subject. I'm gonna get my video guy. Little bit of a haze up there above you, but I think he'll be able to tune that out. I'm sure of it. And so this will get up. So what I'll do is, hang on, let me put on this on stop. So thank you very much for being on the podcast.
Well, that about winds it up for today. Thanks for tuning in to the Holistic Entrepreneur. I'm Zane Myers. If you enjoyed this episode, subscribe to our podcast or watch on YouTube. Join us next time as we continue to explore both the art of healing and the science of business in healthcare. We'll see you next time.